cannabis is not very well studied in clinical trials, but we have tons of evidence that there's huge anti-inflammatory properties. We know that it's been used from a wide variety of conditions for chronic pain, especially neuropathic pain, for seizures, especially in children, and a lot of skin conditions as well. Where, there's this big study published on psoriasis and how it can reduce the plaque formation in psoriasis. So it's not surprising at all that it would be helpful in a condition like ichthyosis. The endocannabinoid system is found throughout the body, in the brain, in the immune system, in the nervous system, as well as in the skin. Actually, skin cells have cannabinoid receptors in them. And so putting them on topically, you're going to get that action directly where it's needed. Taking it internally, you're going to have a lot of other effects because it's going to impact the brain and the immune system and all of those things. Now, there's a lot of immune system cells in the skin as well, so you're interacting with that. And then the cannabinoids, CBD and THC, also have effects outside of the cannabinoid system. So they affect other receptors in the body. And so we don't understand those that well yet, but we know that there are interactions there. We see effects in CBD that we know doesn't directly affect the cannabinoid receptors, but it still shows a decrease in inflammation. It still shows a decrease in proliferation of those skin cells, which is the big problem in ichthyosis. Do we know exactly how they all work? No, there's still way more research that needs to be done, but we know that there are interactions that can be beneficial. Do we know exactly how it's going to work yet? No, but I think the one thing we do know about these things is they're very safe. You're not going to get severe, bone issues or kidney issues that you would with some of the pharmaceuticals. Yeah, unfortunately, the environment we're in right now, it makes it really difficult to do any clinical trials on cannabis. Clinical trials, in the pharmaceutical industry can be fast-tracked if you have the money to pay for a trial, and the regulations are much less. When you try to do a cannabis trial, it's very hard to get through. It can take tens of years just to get approval to do a study, and people don't have that long. And the fact is that the pharmaceutical industry has incentive to make new drugs, and cannabis, there's just not that drive to produce products or to produce studies that show benefit. In fact, there's disincentive for pharmaceutical companies to have studies that show that there's benefit to cannabis. So I think it's difficult to to factor in all of the things that are going on here, but a lot of it is the pharmaceutical industry. A lot of it is just the slow process in the government it takes to get things going, and the restrictions on cannabis right now that make it really tough. But the good news is that there's states like Nevada who have laws that allow people to have access to cannabis products. There's a lot of frustration from people about the medical system. People are not getting to spend time with their doctors. They're not building relationships. They're giving a complaint and then getting a medicine, and that's for common conditions. I can't imagine the frustration that parents have for something where every doctor that they go to is just like, I don't know what to do, so that must be extraordinarily frustrating. And seeing somebody, going out and finding the different options and finding something that works, it's absolutely amazing. I'm really happy that people are doing that. I think people still need guidance and trying to find doctors who are willing to work with them in different ways. And maybe that's seeking out things like cannabis or seeking other holistic methods. But I think it's something that more and more people are turning to because they're just frustrated with the care that they're getting in the traditional medical system.